Professor Bambs, the floor is yours.
Good morning to all the participants in Chile and good evening to all our colleagues in China. My name is Claudia Bambs, professor at the Department of Public Health at the Faculty of Medicine at the Pontificia Universidad Católica de Chile. I want to give a warm welcome to all the participants, academics, students, and general public from our countries, and give you a welcome to this international webinar between China and Chile. This webinar is part of a series of activities that has been in place this week to celebrate the anniversary number 50 of the collaboration between China and Chile. Today, we will focus on the discussion on health care and surveillance challenges during this pandemic. We want to share our experiences and explore further collaboration opportunities in the areas that our teams identify as priorities. So thank you to all for attending, and I want to welcome Professor Cheng.
Thank you, Claudia. Dear Dr. Bertrand, Vice President of Catholic University. Oh, no problem. Yeah, dear Dr. Alvaro Vera, Director of International Affairs of the University of Chile. Dear Dr. Claudia Bambs, the Head of the Public Health Department, Catholic University. Dear Dr. Xiuying, Director of Department of Scientific Research, Tsinghua Changgung Hospital, and all my friends in Chile and China. Good morning and good evening. I just like to mention at the very beginning, at the end of 2018, with the donation from Luxi Group, we actually the Tsinghua Latin American Center has been set up in the year. Within this year, also with the support from Tsinghua Spring Breeze Foundation, the medical team from Tsinghua Changgung Hospital, and expert from other associate Chinese hospital have been working very hard with their counterpart, actually the Claudia's team in Catholic University for fighting against COVID-19 in Chile. They have been doing several important meetings discussing the very important topic like diagnose, intensive care, and quick tests, etc. And now both teams are willing to collaborating more in research, trying to find out sufficient solution for the current pandemic situation in Chile. I would like to express my sincere thanks to Dr. Bertrand. Your strong support is the confidence behind us. I would like to express my sincere thanks to Claudia, your brilliant leadership for guiding the whole process for the efficient discussion one time after another are very much appreciated. I would like to express my sincere thanks to Dr. He and Dr. Yang, the leaders of Tsinghua Changgung Hospital. Your attitude of high responsibility are very much respected towards the question that our Chilean friends raised of some which are beyond the expertise of Changgung team. Dr. He put a lot of effort by inviting experts from other renowned medical institutions inside and outside Tsinghua University. I would like to express my sincere thanks to all the members for both teams for your deep caring for people's life and your great effort in the whole process. I would like to warmly welcome Dr. Feng and his colleague, Dr. Zhao from Vanke School of Public Health for joining us today. And your knowledge and expertise will be very valuable to us. So vaccine is something now, everyone would expect. But what we can depend more is the full trust among us, is the strong innovative capability created by our collaboration, and is the strengthened confidence deeply rooted in our honest friendship. We, together, will win the battle against the pandemic in the end. I wish today's event a big success. Thanks for listening.
Thank you, Professor Tao Cheng, for your inspiring words. Now, we want to welcome Professor Pedro Buchón. He is the Vice President at the Pontificia Universidad Católica de Chile. Professor Buchón.
Good morning, Claudia. Director of International Affairs of University of Chile, Mr. Eduardo Vera, Director of the Latin American Center of Tsinghua University, Mrs. Tao Cheng, Director of the Department of Public Health of the Faculty of Medicine in Catholic University, Ms. Claudia Bambs. And I would like also to specially greet our speakers today, Ms. Paula Margozzini, Specialist in Public Health and Family Medicine of the Department of Public Health at Pontificia Universidad Católica de Chile, and Mr. Feng Cheng, Director of Global Health Program of the Tsinghua University. Also, of course, I would like to really thank all the authorities that are present, or the team members from both sides that are present today, our panelists, our academics, our researchers, a special welcome to our students who are attending today. And I hope you are able to get good lessons about what is going to be discussed. It's a great honor for me to be able to give you some words in this celebration of the 50 years of collaboration between China and Chile in this particular panel that is devoted to the healthcare and surveillance challenges during COVID-19, in order to share the experiences between Chile and China. I believe that during this seminar, we're going to be able to identify the key challenges for improving the pandemic control, which is a global challenge that requires, in turn, global solutions. And also, I hope that we are going to be able to discuss about innovative strategies to improve testing, tracing, and isolation. In that respect, it's very, very important the need finding and the understanding of the patient's history and the patient's experience that has happened in both sides. And certainly, I hope that we will be able to learn lessons and how to better prepare for a second wave, including the public policies that we should help improving and implementing in both sides, as well as a critical assessment of the health systems in both sides. I would like to highlight the genuine interest between teams from both countries, and especially acknowledge the collaboration from China during the whole year. This has been a very critical collaboration that has been led by Dr. Tao Cheng, who I truly would like to thank for all the support from the China side, from Tsinghua University, but certainly not just from Tsinghua University, but being able to gather experts from Beijing and the whole country that has been in the front line confronting the pandemics. This has been really a very critical year where collaboration, as we are experimenting at this moment, really goes beyond our frontiers. And the possibility that we have been able to establish this year in order to cooperate between both countries in different domains has been extremely positive, particularly in the health science domain, where we were able to really discuss critical questions that were professionally addressed from both sides in order to help the feedback, particularly from the Chinese experts who were much more in the forefront of knowledge because of the history of the pandemic, and also because of the scientific and technological advance that they have been able to show us during this year. And really this experience, this exchange, this genuine and generous collaboration has been very much appreciated from our side. And I truly would like to really acknowledge this at this moment, as well as the genuine interest from both teams in this particular seminar to cooperate. Of course, the leadership of Dr. Bambs has been extremely important in order to be able to carry out this seminar, and not just the seminar, but the conversation, and to gather the professionals and being able to really articulate the relevant question to be addressed in order to really improve the health of both countries and being together a team in order to confront the challenges of this pandemic. And also I would like to thank you, Dr. Feng, for his leadership from the Chinese side, leading and gathering a group of professionals who has been instrumental in order to nourish this cooperation. So thank you so much from our Chinese colleagues, and thank you so much as well to University of Chile for being able to be present with us today in order to not just develop this seminar, but all the seminars that has been developed during this week, as the inter-university cooperation, inter-institutional cooperation is critical in order to really address these global complex challenges. So thank you so much for giving me the possibility to express my thanks notes during this seminar.
Thank you very much, Professor Buchon. We feel very, very happy to have you for this opening ceremony and to greet all the authorities and colleagues and students which are present. So thank you to all of you. And now I will tell you something about our agenda for this seminar. We will have two main presentations. And the first one will be in charge of Professor Feng Cheng. Professor Feng Cheng is a teacher at the Vanke School of Public Health, the Vice Dean of Student Affairs at the School of Medicine, and Commissioner of University Degree Committee on Medicine and Biomedicine at Tsinghua University. So it's my great pleasure to greet Professor Feng Cheng to give us the first presentation.
Thank you for your kind introduction, Professor Claudia Bambs. So now I'm going to share my screen, okay?
Please.
Can you see clearly?
Yes.
Okay, great. So again, thank you. And good morning, ladies and gentlemen in the Chile side, and also good evening, the colleagues and students in the China side. So this year, as you mentioned, is marked as the 50th anniversary of the diplomatic relationship between Chile and China. So I'm so pleased to attend this online seminar on the healthcare and surveillance challenge during the COVID-19 pandemic. So it's an important topic right now. So I'm going to share with you some China experience on the COVID-19 prevention and control from my own perspective. So we can, if you have any question, I'm happy to discuss with you later, maybe also in the future. So in next about 20 plus minutes, I will introduce you the technical strategy for the COVID-19 prevention and control. So basically we have two strategies. We call the containment and zero COVID-19. I will explain it. So the COVID-19 epidemic situation and the trends in China, and this dynamic trends confirm the success of the technical strategies. And then I will explain some key factors associated with successful implementation of those technical strategies. So for example, the leadership and structure system, okay? And also the public understanding and the collaboration. So before talk about strategy, I would like go through very quickly on the orange of the outbreak in Wuhan, my hometown actually. So we remember those important days in the beginning of epidemic. So on the 27th December 2019, so Hubei Hospital of Integrated Traditional Chinese Medicine and Western Medicine reported the cases of pneumonia without any reason, without the unknown etiology. So, and the report cases to the Jianghan District CDC, the Center for Disease Control and Prevention. So in one district CDC in Wuhan. So this doctor names the Zhang Jixian. She experienced the SARS outbreak in 2003. So he had a lot of experience for the emerging infectious disease. And he noticed unknown cause pneumonia with the family gathering phenomena and report to the government. So on January 5th, so Wuhan Health Commission announced there are 59 similar cases in Wuhan. So 2 days later, China CDC successfully isolated the novel or new coronavirus strain, so named the pneumonia infected by the novel coronavirus. So that is quite very quick. So on the 12th of January, and the various genome sequencing information was shared globally with everyone, so people can start to develop diagnosis tool and vaccine and drug development. So, and on the very late evening, on 19th January, so the famous Zhongnansan, the Chinese famous the expert on the infectious disease, and he went to Wuhan and with a group of the people from different places, the Chinese infectious disease expert in Wuhan, and they confirmed people-to-people transmission. So we have a lot of new diseases, and especially for the virus infected diseases, and from the human to people, and then stopped. And this time we confirmed on the 19th January, so people-to-people transmission, that is important to be noticed. And so in summary, so in the very beginning of the pandemic, China discovered the virus very quickly and precisely, and share information globally and timely. So let's look at the 2 technical strategies for the COVID-19 prevention and control. So use nationwide. One is I mentioned this containment strategy, and otherwise zero COVID-19 strategy. So actually, I gave the name of zero COVID-19 strategy, but I can explain why. So China applied the containment strategy in the early period of conforming the people-to-people transmission. So from the 23rd January to 22nd February. So this strategy is widely used in most part of China. And in the Wuhan and the Hubei, they extended to the April 8th in the Wuhan and the March 25th in Hubei. So the result was excellent, you know. So everybody know we get the eradicate the virus epidemic immediately. So in face of the previously unknown virus, the China has rolled out perhaps most ambitious and very aggressive disease containment strategy in history. So even for us, it's never happened before. So nationwide, we promote the universal the temperature monitor. So even today, when we go into the canteen to the classroom, so we have the temperature monitor. So and then masking and also hand washing. So however, as the outbreak evolved and the knowledge was gained, because new virus, we don't know much about it. So and when we know more, and the science and the risk-based approach was taken to tailor the implementation. So specific containment countermeasures was adjusted all time according to the provincial and also county and even community context. If the context difference, and then we change the policy, change strategy a little bit. And the degree of containment is varies. So the capacity, also the setting of the capacity, and also the nature of the law of the coronavirus transmission. So as rapidly as that knowledge have merged, and they have been consistently refined of the specific aspect to like incorporated the new knowledge into the containment strategy. So, and also you notice the remarkable speed with Chinese scientists and the public health expert, like isolated the causative virus, and also establish diagnostic tools, and also determine some of the key transmission parameters. So, for example, like a route of spread and the incubation period, and also provide evidence base for the China strategy. So gave some very valuable time for the response nationally and globally. So the second strategy, I personally call it zero COVID-19 on the new normal period. So that is actually started from 23rd February to now. So when we open the business, except Wuhan and Hubei in the early stage, as I said, Wuhan to reopen on the April 8th and Hubei in the March 25. So what is new normal? So we all life come back to the normal, but not the normal as before. So that's have 4 conditions. So coronavirus will coexist with human for a long time, probably can reach to the 2025. Some scientists already mentioned. And also they mentioned every outbreak maybe every year, right? And second, the outbreak by imported cases or objects, like we confirm some like a packaging, the contamination, and then cause the community secondary and the third, first, second, and third generation of transmission in community. The third one is the study showed the COVID-19, the antibody only exists for 40 weeks or even shorter or less. So the vaccine development and application takes time, right? So, and the fourth one is for the development reason, for sustainable development purpose. So it is very necessary to balance the economic and the social development and the disease prevention and the control countermeasures. So that is the science and the art to how to balance the two different contradictive purpose. So on the new normal, after eradicated the native, the indigenous, the cases, the China shift provincial focus on importing cases issues, even today. So all international travelers must have 14 days quarantine or medical observation in the sites, in the assigned and designated sites, and taking the nucleic acid test. But actually this is very, very big task. For example, in Shanghai, every day, we have quarantine like 50,000 international travelers, and Shenzhen and Guangzhou, Shenzhen, and Zhuhai, and is 60,000. 3 airports together is 3,000. The travelers, inbound travelers, and then we have to provide the individual room for 14 days for everyone. So it's huge task in now. So in China. So for any cases discovered in community, so if it happens, so we mainly rely on 3 most important magical weapons: the contact tracing, mass testing, and free treatment. So the first, the contact tracing use the information technology and the big data, quickly found the source of the infection, and solve the problem and finding and controlling the close contact of infected people. So through the field epidemiological survey and the investigation and the diagnosis of the virus, so we can know who is likely to infect him or her, and then he will infect to who. So we can really have quite, so that is to say we can have a quite a clear picture about the various transmission chain, and then we can cut off the chain. And so this field investigation, or sometimes we call it contact tracing, is very necessary and important countermeasure. And the second one is mass testing. So once we have local community transmission happened, and large scale nucleic acid testing will be carried out immediately. And the infected people is found, and the lower the transmission probability is, right? So we have a nucleic acid screening, and then we have confidence because we know the real situation on the ground quite clearly. And the third one is free treatment. So China provides free treatment for every and all COVID-19 patients. So that means we can manage the source of infection as much as possible. So anyway, that is China's strategy, but it's not real. It's very traditional. So this principle is the same as what already written in the textbook for decades, right? So there's 4 earlies: early detection, early report, early isolation, early treatment. Everybody know it. But the real question is how to implement those 4 principles in different cultural settings. So that is important. Okay, so let's move, look at the next 2 slides. So I'd like to show the COVID-19 situation and the dynamic trends in China to review the outcome of our 2 different strategies in the 2 different stages. So this graph shows you the newly reported the COVID-19 cases every day from 20 January to 20 February in China. So the x-axis is by day and the y-axis is by number of cases, but pay attention please to the scale of the y-axis. So that the 1 scale equal 2,000 cases, okay? 1 scale is a lot. So on the 23rd January, Wuhan lockdown, entire city with more than 10 million people closed on the 23rd January. And the 24th January, we have the national medical team to the Wuhan and national aid team to Hubei. And the 25th national government leadership team set up for the COVID-19 control. And on the 27th January, the central government steering committee headed by our vice premier Shen Chunan to the Wuhan, and she stayed here actually with the Wuhan people, with people, the closed city people, for almost 3 months until the Wuhan reopened. So on the 2nd February, the community screening of the 4 types of the people, like confirmed cases patients and the suspected patients and the fever patients who have unknown infection, and also the close contacts of the confirmed patients. So on the 12th of February, you can see the highest, the peak, like more than 14,000 a day, due to that's because of the change of the diagnostic standard. Because that time we have diagnostic tool, but we don't have the enough the capacity of the diagnosis, because the diagnosis need request biosafety P2 laboratory. So we only can do 200 tests that day at the very beginning, but not today. Now we can do millions, 1 million a night. So in 1 day by using like a mixed method, and also by the rapid test. In China, the rapid test as fast as the 15 minutes. So we can get the test done. So on the 18th February, the very important day after about 4 weeks hard work. So we have more newly discharged cases than newly diagnosed cases. This is really the turning point in the Wuhan. So more people leave the hospital than entering to the hospital. So This is very hardest time in China, and then we come to the normal, we call that the normal time. So far this morning, China have like 1,672 diagnosis cases and 198 asymptomatic patients and 4 suspected and only 7 suffering cases. So with the zero COVID-19 strategy, China might maintain the very low level of endemic. You can see the graph, right? So this graph shows you that the outcome of the zero COVID-19 strategy from the 23rd February to today. So, but also pay attention to the y-axis. So the number of that one scale only is the 100. So in almost most of the time that we have the cases less than 100, and most of them, almost most of them are imported. But we do have some like sporadic outbreak after Wuhan problem solved. So for example, like we have the border area with Russia in March and April, some outbreaks, and Beijing in June, and Urumqi June and July, and Dalian, Qingdao early October, and also Beijing yesterday we have found out the community infection. So we will do we use the 3 magic weapons to handle this. So, but in generally speaking, so if new epidemic cannot be found and bring out of control within 2 incubation period, like 3 to 4 weeks, and then the largest scale community outbreak were occurred. So we have to do things very quick, as soon as possible. And one more thing I'd like to mention here is cold chain, because the transmission through the contaminated object like overseas packaging. According to the China Center for Disease Control, so the the coronavirus was detected and isolated from some outer packaging of the imported frozen cold fish in the Qingdao. And also it's first time in the world that the live coronavirus was isolated from outer packaging of the cold chain food, and then conformed several times in the different polled samples. So this is ring alarms about the new infection transmission. There's a new challenge for China and for any of us. So you say that there's 2 graphs show the corona trends in China that is confirmed all technical strategy are correct. So we are quite successful. And but how to make sure this small implementation, this technical strategies. So I think it's the 3 things are important. So the first one is leadership. So New England Journal of Medicine published, I think most of you probably see this already. So and the editorial piece on October 7. So like dying in leadership welcome. So the COVID-19 has created the crisis throughout the world, and this crisis have produced a test of leadership. So because with no good option to fight the new and lower the pathogen, so countries were forced to make hard choices about how to respond, how to balance economic development and disease control. So when China faced the first the COVID-19 outbreak, we chose the strict quarantine and isolation, and then control the epidemic rapidly in Wuhan and Hubei. Meanwhile, immediately we focus on the economic and social development immediately. So you know, since outbreak of the COVID-19 and the China Communist Party Central Committee So with President Xi Jinping as its core, have put the people's life, safety, and health as a top government priority. So she also chaired multiple meetings and delivered speeches, and also, for example, as early as the February 23rd, when President Xi met the senior leaders, he emphasized on coordinating COVID-19 response with economic and social development. So in February, we already shift focus not only in the disease control, it's both sides. So disease control and the economic development. So as early as the February, not now. So now we can say we can move freely, and our GDP is okay. So I think probably in the previous the seminar you already discussed a little bit, I believe. So so in that meeting, the President Xi asked us to review the performance in the past months, and also identify the current priority for the prevention, and very much emphasize on we should work on two legs. One is the disease control, and one is the economic development. So otherwise we cannot have sustainable development. And of course, it strengthened the party's leadership, ask all the government officials taking their higher responsibility, and in this critical moment. And personally, President Xi come down to the Wuhan on the March 10. So it's most and first affected area in the world. So by the COVID-19 virus. So that is first. I think leadership is very important. And the second one, how many time I have? Sorry, 25 minutes, right? Okay.
Yes.
So your structure. So I think the second factor is really structure. So for implementation the strategy. So because some of my foreign friends ask me why China can do it so well. So any kind of system support or prevention work. Yes, from this you can see the map. You can say a good health system. So design structure operates from top down to the bottom in our society. So if you look at this map vertically, we have 5 levels government administration system. So central and state level, provincial level, city level, township level, and village. So township level and above, we have government office. So we have the health facilities in our level, from the village to clinic, village clinic to big tertiary hospital in the city. So the different levels, and also across the different government agencies, the people have the different responsibilities, like development commission and education commission for university training and HR and the finance. So they're all involved in the health systems. And you can say 3 different than 9. One is the subordination, and one is business management, and one is the guidance, like technical guidance. So if you look at, so if any order from the top and they can down to the bottom, and then if any problem happens in the village, and they can report immediately, throw the system up. So that is also I think is important for when we implemented our technical strategy. So and the third one is the public understanding and the collaboration. So at the central level, there's a daily press conference of the COVID-19 prevention and control every day 3 p.m. So, and by doing this, and the press invite expert, the expert explaining the people's concern, and also ask officials to explain the major policies and the major problems, and engage the citizen in the epidemic prevention and control. So the clear and correct message come out every day. Very clear and correct message, no mixed message. So every day you watch the TV and you get what you want. So this kind of this kind of citizen engagement and now some safe management and also active participation in epidemic prevention and control, right? So meanwhile, the mass media can really do a lot of, can make the people, the population involvement, actively participation in the fight. So that is also quite important. And like show you the picture, 3 picture on the bottom. So when the lockdown, I was in Wuhan, and then the community volunteers to buy food for us. So you just send the text message or use the app to make a request to the neighborhood community, and neighborhood community will give you immediately. Usually in 1 or 2 hours, they will buy anything you want for you. So, and the second picture is when I come back to the Beijing in the March 30, and then I have to quarantine myself at home for 14 days, and the community neighborhood center put the white box on the top of my door. Did you see the white box? Actually, it's sensor. So every time I open the door, and the message will automatically deliver to the community center. So and then if I open door many times and for long times, and then maybe I have to do the other 14 days quarantine. So anything if I want, I can do in home, but not outside of my apartment. So and then in June, Beijing have the epidemic, and the people will come down to the yard and to have testing, and in that time in the June is in 2 days you can get a result. But today I think we can have a result in 1 day. So this is also the third point I want to make is the public understanding and the collaboration. So in the WHO report, during the WHO China Joint Mission report, and this make some comments, achieve China exceptional coverage and adherence to these containment measures has only been possible due to the deep commitment of Chinese people to the collective action in the face of this common threat. So this morning I like the one at last slides. I hope I still have 2 minutes. So and talk about the China vaccine. So you know, in the very beginning of the epidemic, we are thinking about in order to maximize the success rate and the speed of the research and the development of the COVID-19 vaccine in China. So the early days of outbreak, the Chinese Ministry of Science and Technology and top Chinese scientists to identify the 5 technical approach for developing vaccines, because we don't know which road will lead us to success. So we designed 5 roads. One is the inactivity vaccine and recombinant protein vaccine, and adenovirus vector vaccine, and the vaccine used the attenuated the influenza vaccine as the vectors, and also the nucleate X vaccine like DNA and RNA vaccine, right? So right now we have 15 vaccines in the clinical trial right now, because we don't have patients in China, so all the clinical trial have to be conducted outside of China. So that is a challenge. So right now the 5 Chinese COVID-19 vaccine candidates very close to finish the phase 3 clinical trial in more than 10 foreign countries. But UAE actually they reported that the trial closed, and the efficacy is the 86%, is quite good, and the Brazil partying. So China vaccine, this 5 vaccine is quite safe, and the effectiveness and accessible and affordable, is not expensive, and use the normal EPI chain. So right now, like a Pfizer vaccine, have to store in the -70. So your vaccine have to store in the -70 is big barrier for the field applications, who and where you put your -70, the refrigerators. So that, but in China vaccine, is we can use a normal EPI chain, use the cold room like 5 to 8 degrees centigrade, and the normal temperature you can use it. So that's quite different, the big difference. And actually, China FDA authorized the urgent use of the COVID-19 vaccine in June. Actually, we vaccinated more than 1 million people here in China. And yesterday, we exported 1.2 million to the Indonesia yesterday, by request the president. But the last one is the China already joined the COVAX. So COVAX is an international initiative. So the COVAX aim to ensure the equitable global access to the COVID-19 vaccines. Last month, several, I don't know, the United States and some other industrialized countries didn't agree to join the COVAX, that they want to produce vaccine and use it by themselves, right? So, but China is already joined the COVAX, and also agree as the China vaccine or make China vaccine as global public goals. So not only benefit to China and benefit the people in the other countries, especially in the developing countries. So so this is what I'd like to share with you this evening or this morning, and thank you.
Thank you very much, Dr. Feng Chen, for this fantastic presentation. And please stay with us for the panel discussion. And now I have the pleasure to introduce our second speaker for this seminar. I want to welcome Dr. Paula Margozzini. Dr. Margozzini is an assistant professor and a specialist in public health and family medicine at the Department of Public Health, Faculty of Medicine at the Pontificia Universidad Católica de Chile. Welcome, Dr. Paula Margozzini. The floor is yours.
Thank you very much, Claudia and Dr. Feng, for your very much interesting presentation. I will share the screen now, and thank you also to the organizers for this opportunity for sharing experiences with our colleagues from China. So there I am. Do you see my screen?
Perfect, perfect. Go ahead, Paula.
Okay, thank you very much. So what I would like to share with you is very much complementary. It's a view about. I will give a bigger emphasis on context variables, because you know, in contexts we mainly find determinants of disease variability. So this could make our discussion, I think, rich for comparison between China and Chile. So the Chilean context, I guess our population, over 19 million people, is somehow similar to the Beijing city area, maybe. We are mainly urban population. It's a very urban country with big cities, big overcrowded cities, especially the capital, where over than 40% of the people live there. Our GDP is over 20,000 US dollars, and we have developed a very good indicators and health outcomes. We have over 80 years life expectancy and development index over 80, ranking 45. We are a country that has made a very accelerated epidemiological transition. We have low child mortality, less than 7 per 1,000 live births, and we have low health expenditure. This is a mixed health system with private and public health insurance, and over 95% of the population have mandatory health insurance, and COVID-19 treatment and testing is covered by this insurance. So you have access to treatment and testing with coverage of health insurance. So, as I told you, we have a quite high life expectancy, and there is a very important characteristic of our extremely accelerated epidemiological transition. We have become the country with the highest overweight obesity rates in the OECD. You can see Chile here in red. Over 70% of our population has some kind of excess weight, which is quite important for facing this pandemic challenge. Chilean epidemiological profile really increases risk for severe and fatal COVID-19. We have over 2 million people that are over 65 years old, with a very high prevalence of chronic diseases such as cancer, diabetes, hypertension, and very high prevalence of risk factors such as alcohol and tobacco consumption, as I said, obesity, low physical activity, poor eating habits, and unhealthy lifestyles. I tell you all this because never in our history, NCDs, non-communicable diseases, have come to have become so important in our, I would say, our country's destiny. We really knew that NCD burden was high and was having a very high social and economic impact in Chile. But this pandemic has made NCDs come in front and showing us crude numbers, really crude numbers. In Chile, over 70% of people 15 years old and over live already with 2 or more chronic diseases. So about 17% of our population live with 5 or more simultaneous chronic diseases. This is what we call multimorbidity. So I'm talking about over 2,600,000 people with very, very high risk. And those people are the ones that really have the most severe COVID burden in our country. They are the ones that have gone into ICU care, and they have had the worst case fatalities. So we could think, and also 80% of them are less than 65 years old. So if you take this over 2 million people plus the elderly, you will get fast to a number around 4 million, 4 or more million people in our country with very, very high risk. As you see, this 4 million people cannot hide anywhere to protect them. They are inside our community. They are walking inside our community. So we have faced this important challenge on how to protect them. Also, Chilean context faces a very important socioeconomic gradient in health. Inequalities in health risks have made COVID-19 impact in higher impact in population with lower socioeconomic levels. We already knew that hypertension, diabetes, and most NCDs have a higher burden in lower educated populations. And this has been produced in COVID severity and case fatality. We have seen that there have been more incidence rates in counties with lower socioeconomic rates and higher ICU rates and higher mortality in those counties. Mortality in Chile during 2020 has shown very particular features. We have documented excess deaths. Excess deaths have been occurring mostly between June and November, mostly between June and November. Mainly the highest excess occurred in June and July. And there has been no excess deaths in the population under 30 years old. Most of excess mortality has been seen in over 50-year-old people. And this is when comparing with previous rates from the 5-year period before we started the pandemic. So excess deaths have been clearly caused by COVID-19, and all this excess mortality has been documented as COVID cases. We have reached more than 20,000 total deaths in this month. Our first case was in March. So we have 9 months going on with this pandemic. And our cumulative confirmed COVID mortality is over 800 per million, which makes us face about the number 17 highest mortality in the world. And case fatality of confirmed cases is over 2%. Case fatality of infection, community infection, is not known, but we have some data that would suggest that it would be under 1%, maybe 0.6 or 0.8%. because we have some post-peak serological population studies that would tell us that not less than 20% of the population has already been infected by COVID. So we have a big 80% of the population still susceptible to COVID infection. As you can see here in this slide, which is very interesting, is that about 18% of our 2020 mortality has been caused by COVID, coming to be the third cause of death behind cancer and circulatory cardiovascular diseases. Here I'm showing you ICD codes, all codes, confirmed and suspected COVID codes that come to sum the over 20,000 deaths. Chile faced this challenge starting with a quite low hospital bed rate per 1,000 inhabitants. We are part of OECD, so we can compare countries, and we had less than about two beds per 1,000 inhabitants when this started. So one of the big challenges faced by our country was how to search hospital capacity. And this was a strategy that started early in the summer, January, February months, and we reached very impressive hospital critical care search capacities, getting over 400% increase in invasive ventilation capacity. And we also incorporated new technologies that we didn't use as much before COVID, which were incorporation of high flux nasal oxygen. And as you see, we had the peak surge in June, where we reached about 2,000 invasive ventilation capacity beds. And since then, we have had less ICU requirements, but they have stayed high. So over 500 people are still using invasive ventilation in our country every day. So how was the response organized in Chile? Well, it was led by the president and the health authority. Health authority mainly by means of the health minister and public health secretary, and the division of health planning, which has which is the place where all health surveillance occurs in our country. And there was a special notification, mandatory COVID notification system, and this was managed by this division. This division is a centralized division, but it has 16 regional health authorities for geographical regions in Chile. This could be like similar to the CDC China, centralized agency with 16 regional offices in Chile. So we started, we had to search this surveillance capacity very fast. We faced important problems. We had never had this burden of data to collect, and our systems were not capable in the first days to do this. So we had to improve this constantly. But finally, COVID-19 surveillance data sources are abundant in Chile, and Chile has a lot of information. It has official data freely available from the government in different sources, with constant communication to the community by TV, similar as what we have just seen for China, and by also information on the web on different variables, and mainly epidemiological surveillance indicators. There's a specific indicators that are communicated for testing and tracing and for mortality reports. And all data is available in GitHub. Ministry of Science and Ministry of Health have made this consortium so data can be freely available for all in our country. There's also a university consortium with the Ministry of Health and Ministry of Science. It's called COVID Chile initiative, in which our university and Chile, University of Chile also participate, which has been a very important technical assistance for stakeholders in the Ministry of Health, and it is an ongoing project. COVID transmission dynamics in Chile. Well, here we have the daily rates per 1,000 and effective reproduction numbers. Actually, we are facing daily over 1,700 cases daily. So rates are coming in December to come over 10 or reach the 10 threshold, the 10 per 100,000 daily rate. And we have been facing this high rates for so much months. You can remember in Dr. Feng's presentation, they had different patterns, because in China, they reached 100 cases per day, like going much near 0 cases. Instead of us, after the first big wave where we had over 6,000 cases per day in Chile, we have faced continuous high rates over 5 per 100,000 daily cases, between 5 and 10. And there are also some geographical regions that have higher rates, over 50, over 60, 70 in the southernmost part of our country. So we are facing over effective reproduction numbers over 1 in the last months, and mainly in the last weeks. This is a national phenomenon. But we have a very asynchronous pandemic in Chile, meaning that our 16 geographical regions have this 16 different epidemic curves. Here you can see epidemic curves. These are the, in the x-axis, you can find the dates of symptoms starting. And in the y-x, you have cases. These curves show observed cases, but we also have done forecasting, because there is quite a delay, you know, in notification and laboratory outputs. So we have modeled and corrected data forecasting, so we can have present daily cases estimated in as more real numbers. And this has been important for decision making and tracing and the surveillance of this epidemic. So as you can see, in the south Chile is from this place, from the metropolitan region that is in the center of Chile on. So all these places, these regions are in the south, and these regions are in the north. So we now are facing quite high epidemic rates in both north and south. I can show you here the southernmost region in Chile, which is Magallanes, is facing over 50 cases per 100,000 daily. It has had a very intense epidemic. And this asynchronous phenomena has been important for managing the epidemic in Chile, mostly for managing hospital surge capacity, because we have come to a system where we have integrated all beds in a centralized way. Public and private beds, health authority manages this beds, ICU beds, in a centralized way, so we can send patients from one region to other to compensate for the need of ICU and invasive ventilation. The asynchronous way that this epidemic has developed has made it possible to make this, to send patients from one region to other. If the epidemic was absolutely synchronic, we would have much, much bigger case fatality, and we would have a big collapse of our health delivery system, which has not occurred yet. So COVID-19 health policy response in Chile has been based basically on two big strategies: population-based strategies and individual high-risk strategies. Population-based strategies have done mass media health promotion and risk communication interventions, massive health education about hygiene, social distancing, mandatory mask use, and several regulatory, legally enforced restrictions to movement, stay home orders, no gatherings, work and education closures. This kind of regulatory restrictions have been very intense, and were very intense during the first big wave. We were, most of regions had about 3 months lockdown, and afterwards it depends on the province, county, and region. This regulations, restrictions have been changing based basically on epidemiological indicators. There's a plan there is a stepwise plan organized to take these decisions about regulating movement and stay-home orders. Individual high-risk strategies is basically testing, tracing, isolating cases, and quarantine of contacts. We know this is very, very much important to contain the epidemic, and this has been developing with more coverage, basically about 2-3 months after the epidemic started. And we have been slowly improving our indicators on these issues. Well, the other strategy that is important is what Dr. Feng says about the vaccine. But we know that the vaccine is not going to contain our second waves. We are facing our second waves with the classical strategies. Vaccine coverage will not be enough high until second half of next year, which is expected. So we will be facing COVID challenge mostly all of the 2021 year and the years to come. We have implemented mandatory and law enforced policies in different dates, as I told you, basically issued state of emergency, stay-at-home requirements, instituted international travel restrictions or board closures, restricted large gatherings, implemented curfews, business and workplace closures, closed schools and educational institutions. Our university in particular was the first educational institution that closed early in March, and this has been very important. Now we're coming back. We shift absolutely to online education, and we're slowly coming back and forth, because now we are facing a rise in cases in the metropolitan region. So we are affected by these restrictions as a university. In some moments, closed public transportation and restricted internal movement. We have closed restaurants or pubs and other entertainment venues, and they have a very restricted operation, mainly dependent on the step in which the county or the province or the region is facing. So this interventions can get stricter or less strict depending on epidemiological indicators. We have had a very important healthcare resource reallocation and reorganization. As I said, mainly focused on a hospital surge, but also focused in reorganization and incorporation of primary healthcare. We have had some external aid, and I would have to mention some. We have gratitude to China because of their donation of healthcare resources and in technical exchange. So COVID-19 case detection in Chile is basically focused in the cures in primary healthcare. Chile has a very strong primary healthcare, public primary healthcare system all along the country. We have had quite high, very high testing rates in Chile, over 12 per 1,000 per week. We test symptomatic patients, suspected patients, but we also actively test in the community. Today, about 20% of positive cases are coming from community active testing. Tracking in isolation is driven by primary care and the local public health authorities. And we have performance indicators for these issues. Benchmarking is not very clear for this new COVID challenge. We have seen the indicators in other countries, international benchmarking, but I guess no one is so clear about benchmarking around testing, tracing, and isolating. What we have seen is that times have been changing, and we have focused in several indicators. We have in our iCovid consortium some indicators that focus mainly on the early phases of tracing. I mean, between the date of symptom initiation until people get tested, and from then until the Ministry of the Health Authority receive this data, the official data, in their systems. So we have these indicators, and we see that less than 50% of our positive cases get confirmed to the health authority. Laboratory confirmation is known, reaches the health authority systems in less than 3 days from symptom onset. And early consultation from symptom onset is about 62%. 62% of people that start their symptoms will get notified and will see a doctor in less than 2 days. And our labs have been increasing speed in the last 5 months, and now we have over 60% of people that cases that have the results in less than a day. COVID-19 in health personnel has been a quite challenging issue. 7.6% of cases, COVID cases, come from health workers, and 5% of positive health workers will get into hospitals. Health workers' relative risk of infection versus the general population in Chile is 2 or 3 times higher, which is a big challenge. Finally, I would like to highlight to you some areas that we have identified that need innovative solutions. If I had to summarize in one word the deepest challenge, it has something to do with communication at all levels. Like communication channels between the health system, patients, and their families at home, improving information systems and contact tracing coverage and speed. All this has to do with communication. But also a big challenge of this pandemic in all parts of the world has been the problem with testing, because we don't have a wonderful screening test for COVID-19. And this is the reality we face. So we do need a higher risk population identification to improve cost effectiveness of testing. You know, symptomatic patients in Chile testing have today about 9% positivity. Need for more sensitive tests and mostly easy self-testing at home. We need fast results for both symptomatic and non-symptomatic populations. Work testing, screening, and a huge and important help is needed to improve testing. But this is a world challenge. Improving information systems and contact tracing coverage and speed is another big challenge. And we know there is some technological aid that could come to help in this ways, but there's no magic formula, and there's no technical solution that could speed this up or higher coverage in a magic way. Manual contact tracing is fundamental. It's still fundamental. Still fundamental. So improving isolation and quarantine quality and follow-up is also a very big challenge for us. Our isolation of cases is not mandatory to be done in a designated place as in China. Okay, so PCR positive cases are offered designated places where they can freely make their isolation and also their quarantine. Contacts can also go to these places, but uptake is low. We have today about 10,000 active cases in our country, and I guess about 5,000 cases are using this special designated, centralized, special designated places for isolation. We need a more safe isolation at home, especially on poor, overcrowded housings and low socioeconomic status counties. Mm-hmm. We also need patient follow-up and patient follow-up after hospital discharge. We know there's a big challenge there. Chile has faced a quite low in-hospital case fatality. We are facing ICU management in a good way, but we need follow-up after hospital discharge when people get back home and have several long-lasting health needs. And also we need, there's a big challenge on health workers' risk management. I hope this health workers' risk management issue will be faced in a more because we have prioritized vaccination for them. So we're expecting that this January, February, we will be vaccinating health workers, but we also need to manage these things. Several contributions to the national COVID response. And we have based basically on building capacity to test, trace, isolate, and support mostly low socioeconomic status communities and counties. We have also, we are also participating in vaccine trials, particularly a China-linked initiative, Sinovac Beijing. And also we have had several other working lines on PPEs and respiratory assistant technology, mental health, and ethical proposals, national proposals to face the ethical challenge of COVID-19. We have also participated in therapy trials and risk communication. We have helped to improve social dialogue between stakeholders and communities. We have given technical assistance, important technical assistance to the health authority. We are participating with our professors in the main technical assistance committee to the government. And also we are assisting, giving technical assistance to employers to face COVID-19 protocols, and several research initiatives. We are participating, our department is leading a sentinel population health study on an ongoing population cohort we were running already several years, which will serve as a sentinel center for COVID surveillance. So we have been very actively participating in the COVID response in our country, and we have quite a clear picture now about important challenges we are facing and will be facing in the next months and maybe years. Thank you.
Thank you very much, Dr. Paula Margozzini, for your presentation, and especially for highlighting the areas in need for innovative solutions. We are tight in time, so we'll go straight to the discussion panel. And we have invited for the panel 4 experts, 2 from China and 2 from Chile. And I want to welcome Dr. Blanca Peñaloza, which is a specialist in family medicine and associate professor at the Department of Family Medicine in our university. Each panelist has 5 minutes, can be less, but not more than 5 minutes, to share 2 or 3 ideas, taking into account what we have been listening today and of course their own experiences. So welcome, Dr. Peñaloza.
Thank you very much for the invitation to participate in this webinar, and thank you very much for the presentators for the very interesting speeches. I pay a lot of attention to both presentations, and I would like to remark some reflections related to what have been said. For me, it was very interesting to listen to Dr. Feng about these very clear key issues to implement policies to control the pandemic, related to leadership, to structure, and to collaboration, and the 4 early principles. And when I reflect about that, and also about the things that Paula mentioned, I would like to comment a couple of things that I think are very interesting and the challenges from our country, for my country especially. as a country, we start the pandemic in a very difficult social moment, because we have started a social crisis a few months ago before the start of the pandemic, and we were as a country in a crisis of confidence with our leaders and with the authorities. And I think that's have been one of the most difficult issues to manage, about the confidence of the population to follow, the policies of indicated by our authorities. And my reflection is related to the role of the different actors to improve this social capital. The role of the medium level actors, such primary care or the municipalities that are closer, to the populations, to increase this confidence. And also, and I would really love to listen some comments from our colleagues from China about this tension between the central policies and the implementation in the local level. I imagine in China, you should have a lot of examples because you're a huge country, but in our small country we have very different realities in the north and in the south, and the local implementation have a lot of challenges, and I think there's a tension there that contribute to difficult the control of the pandemic, and that's one thing. And the other things are the technological issues that Paula mentioned at the end of their presentations, that are focused on the testing, challenges. We are now working in the north, trying to implement a serial testing in schools or technical schools, and in some small companies where you have small groups of workers, trying to improve, the performance of the test. But I think that is one of the key issues we need to improve to control the pandemic, and also the issues related with IT issues, to ensure an effective detection and report and isolation of the cases. So I think that could be a very interesting point of collaboration with our Chinese colleagues, and I would love to listen some comments about these two issues. Thank you.
Thank you, Dr. Blanca Peñaloza, for your comments. And now I want to welcome Dr.Xiuying Zhao, the Director of Department of Laboratory Medicine and Chief Physician at the Beijing Tsinghua Changgung Hospital. Dr. Zhao?
Hello, I'd like to share my screen first.
Sure.
Okay with my screen?
Yes.
Dear Professor Claudia, dear Professor Cheng, my friend from Chile and also from Tsinghua University. And my pleasure to introduce the innovative strategies to improve COVID-19 testing in my lab. I will introduce you from these two aspects. First, a brief introduction of COVID-19 in China. As Professor Cheng has already introduced, after Wuhan epidemic of by the April, so there are sporadic cases in China. We employed 4 early strategies, include early detection, early report, early isolation, and also early treatment. especially we provide screening assay to those people whenever want to, and also composite nucleic acid assay to patients at fever clinics. So it is important to build up nucleic acid assay detection. For example, training enough technicians and also improve regions and technologies. First, in my lab, we set up sample processing and nucleic acid extraction workstation. This workstation is a much speedy system and can improve efficiency of RT-PCR. We begin with EXM 9600. This machine can allocate original sample from a sample tube to a RNA extraction plate. It can finish within 8 minutes for 96 samples. And then we put the plate to 6000. This machine is for RNA extraction, and it can finish 96 samples within 12 minutes. And then another 1 hour, we finish PCR amplification.
Dr. Zhao, sorry for the interruption, but in what number of slide are you now?
You cannot see my PPT.
We see your PPT, but only the first slide.
Sorry.
Oh, if you can move to the slide that you are talking about.
Oh, I'd like. How about this? Now you can see.
Yes. Yes. Yes.
No, it's okay. I will talk by this one.
Okay. Perfect.
Okay.
Go ahead. Thank you.
Now I come to this page. Yeah, this slide. So for this machine, it can quickly scan the sample, detect the sample by auto scanner. And it's processing samples very quick and precise. Here is the system, what it looks in my lab. By using this machine, we can finish 12,000 samples within 24 hours. That means if we use 10 sample mixture strategies, we can finish 100,000 people's screen, and all the people can get the result within 24 hours. Another strategy in my lab is use a flash 20 faster assay system. This system includes 4 independently channels, can work independently. For this machine, we can you can add sample in 1 minute, and then finish the amplification in 30 minutes. This machine can detect with the lower limit at 400 copies per mil. So for the third, we used PCR amplification kit produced by Da'an Gene Company. It just update its tag. You know, tag is important for RT-PCR. This tag are suitable for right amplification and can finish the whole RT-PCR within 1 hour. The fourth, we also use a one-step kit for faster, quickly scale RT-PCR. You can add less buffer, sample, and PCR mix in the PCR plate for RT-PCR. The whole process only takes 2 hours. You can get final result for 96 sample in 2 hours. And finally, I'd like to introduce you 2 instant assay for which just get SFDA approval. It based on lateral flow immunity assay. And even can be, I think these 2 assay is surely it can be used for POCT, but its sensitivity would be discounted if compared with RT-PCR. That's all of my introduction, and thanks for your attention.
Thank you very much, Dr. Zhao, for this presentation. I think it's very connected with the challenges and the areas in which we need innovative solutions in Chile. So thank you very much. Now I want to welcome our third expert, Dr. María Soledad Martínez-Gutiérrez. She is an assistant professor and a teacher at the School of Public Health in Universidad de Chile. Dr. Martínez has done her PhD in health services and policy analysis. So for me, it's a great pleasure to have Dr. Martínez with us in this panel discussion today.
Hello, Claudia. Thank you for inviting me, and hello to our colleagues in China. Well, since I have 5 minutes, I'm just going to be very quick. I want to make 2 points, one of which Blanca referred before me, as I knew she would, which is about the importance of the territory and the approach to the control of the pandemic from a geographical point of view. So I saw what Dr. Feng presented in terms of all these different levels of how you say, the healthcare system. And so you have cities and you have counties and towns and etc. And how important it is to have approaches that are tailored for different cultural settings. And this is happening in Chile as well. Even though we're a very small country, we still have very different cultural settings in our country. Yesterday, I was in another seminar where it was discussed if maybe geographical approaches to healthcare is no longer needed because you have remote care now. You have telemedicine and all these things that you can have a consultation with the doctor I could have a consultation with the doctor in the United States, for example. So is it really important that we have like geographically based care? And I would argue, yes, it is very important, because even though you can have like a specialist consultation with someone in another part of the country, really primary care is about the territory, and it's about, as Dr. Feng said, how can you support people to actually quarantine and to actually follow all the instructions that the government are making. So in that sense, I think it's not that geography is obsolete in terms of healthcare. It's that it's more needed than ever, and that we have some things that we can do remotely, but most things even if you do it remotely, you have to know the context where the patient is, it's living and it's calling, and it's what they are, what are the resources, for example, that they have available in their community. So it's really important. I think I want to emphasize that. And the other thing I wanted to talk about was exactly what Blanca said about the the environment in which we had to tackle this pandemic. We were in a context of social unrest, and that has permeated everything in the containment of the virus, especially in terms of legitimacy. Our authorities were not in a very good standing with the population, so it was really difficult for them to actually try to communicate things, and people would believe them, and so for example, at the beginning of the pandemic, there's a lot of people that said, we are demonstrating, we are in rallies, etc. We are in the streets, and the government wants to put us in our houses, and they are inventing the COVID virus. No, but still that happened, and that's very, very important. And I think one of the things that I really want to emphasize is that I think that in some aspects our government has been very inconsistent in their messages. So I think Dr. Feng actually talked about how the Chinese government was very consistent, and they had these messages. The Chilean government has not been that consistent, I think. For example, in terms of restriction of mobilization. In one hand, we have a curfew that's almost like 9 months old now. We had a curfew implemented in March, and we still have a curfew, which is crazy. But on the other hand, there's a reticence of restricting mobilization, for example, for people that incoming in the country, coming from the foreign countries in our country. They asked the 72%, the 72 hours PCR test, but they don't enforce quarantine, for example, which is something that I learned that you're doing. So in that sense, I think we have to think about a consistent message, and how can we do that? I think also the reason, but that's just my opinion, is classism. I think people coming from outside are very difficult to say you need to stay in your house, but other people, yes, they can stay in their house at night with a curfew, so I think classism has a role in this inconsistency that I sense in the Chilean government. So that's it. Thank you very much, Claudia, and very happy to be here.
Thank you, Maria Soledad. We are very happy to have you here, and your comments are very valuable for this discussion. Now, I will welcome Dr. Jiming Su. Dr. Su is an assistant professor and principal investigator at Vanke School of Public Health at Tsinghua University. So please, Professor Su.
Okay, thank you. Thank you for the invitation. I'm honored to be part of this fantastic event. I have never been to Chile, frankly, but I have drunk actually a lot of wine from Chile.
Oh, wow.
So trust me, I have strong connections, embedded in my blood with Chile. It has been always challenging actually to be the last panelist, because all the key arguments have been touched on by the previous panelists. So first of all, I agree with and I echo all the key points raised by the speakers and panelists. I just want to further comment on one thing. In terms of isolation in China, I realize actually many experts from the Chile sites who are specialized actually in family medicine and community care. So I want to view China's COVID-19 containment from the perspective of health system strengthening. China used to be famous for its primary healthcare system, such as its world famous Barefoot Doctor campaign. But after China's opening up, we have gradually developed a tertiary hospital dominated healthcare system. So we have like a huge tertiary hospitals, which have more than 10,000 patient beds per hospital. You can imagine that. And then those tertiary hospitals can have like more than 20,000 outpatient visits per day for a hospital. So that's why, at the beginning of the Wuhan outbreak, lots of patients rushed into those tertiary hospitals. That actually created a lot of problems in China, such as the healthcare acquired infections. Okay, so I personally think, the game changer is the establishment of the Feng shelter hospitals in Wuhan, in China. Those Feng shelter hospitals are large-scale temporary hospitals. Basically, actually, we made good use of the existing public venues, like the exhibition centers. We converted those public venues into healthcare facilities. So there are 5 actually functions for those Feng shelter hospitals in China, namely, isolation first of all, of course, then triage, then basic medical care, and frequent monitoring and rapid referral, and essential living and social engagement. I want to emphasize, those essential living and social engagement. From that, angle, they are not only healthcare facilities, they provide actually social space. They also provide emotional support, right? They, in my opinion, they provide de facto primary care during, China's wartime against COVID-19. So they become communities of patients with mild to moderate COVID-19. So you can even find, some patients, they found their lifetime partners in those hospitals. So I think that's, one thing I want to emphasize. And I think, we have been super delayed. So I try to make this simple. We can talk about, more details afterwards, more technical details. And I look forward to further collaborations. Thank you.
Thank you very much, Dr. Xu, for your valuable comments. We are coming to the end of this webinar, and of course, we may keep all these valuable ideas and thoughts in mind. And but before we leave, I want to ask my colleague, Dr. Jingwei Bai, to give us a brief, very brief comment about an innovative solution that he is working on in China. I don't know if Dr. Bai, are you here still?
Yeah, I'm still here.
Yeah, go ahead, please.
Thank you, Claudia. Very glad to talk about my work here in China, in Tsinghua University. We are working on, let me share my screen. Okay, let me see. All right. And, just a moment. Try to. Okay. Where is my? Okay. Can you see my screen?
Yes.
Oh, yeah. So
yeah.
I just want to briefly show what we are working on. I made a PPT, and the system of what we are working on is called Venus Box for instant nucleic acid screening for COVID-19. So what we are working on in the past almost 8 months is to try to develop a hand operatable box. You can do the COVID-19 nucleic acid diagnostic at home. So we developed a chemistry called the NEST instant isothermal amplification, next isothermal amplification to get the sensitivity less than 500 copies per mil, and you can do it from the sample to answer in 30 minutes. So just to show the box. Oh, let me see. It doesn't. Okay. So the box itself. So we can take the swab from nose or the throat and throw inside of this box. Inside the box, we can see there's a microfluid cartridge and a PCB heating board, and the result was showing out by the what we call the Claudia Gold testing paper. So our previous result, our current result showing that we can get about 200 copy. Some of them can get 200 copy per mil, and some of the typically the LED can be stable around 300 copy per mil. And we compared our assay with the famous case 12A, the Sherlock system, and we showed a 10 times improved the sensitivity. And another thing I used to introduce to Claudia, and I think that which is the more interesting one is the one-port nest ITA process, because the previous box we estimate the cost itself is kind of a little bit expensive, and I think to make it we will figure out we are trying to optimize the whole system to make it simpler in operation, because the previous one, the nest ITA, which means we have two steps of amplification, nucleic acid amplification process, that actually which is not easy to operate at home. So we invented a microflow system to include all the chemistry inside, and you can operate by the knob and pulling and push. But later on, we optimized the whole system to combine the two amplification steps in one chemistry system. So you just need to add use the swab and try to lysis, and to use the volumetric pipette to take a certain volume into the reaction mix. This is a one-part reaction mix include two steps of amplification. The second step of amplification will start it automatically after a certain time. And the whole system was heating up not with the PCB board, it was heating up by just the very low cost of thermal pad. And later on, you can visualize the result by just fluorescent. We enable that by the very cheap, low cost LED with some button battery, and to filter by a 1 yuan RMB filter. So you can see it generally it can create like a visible fluorescent green fluorescent light in 30 to 40 minutes, and you can do it very easy at home. I think the whole cost will be around 10 to 15 yuan RMB. So another thing we are very happy is because we make it into one pot, which means the reaction amplification actually in one tube, and we read out by fluorescence, which means we don't have to open up the tube and take it out to do the colloidal testing paper. This closed system will greatly improve the will reduce the environmental contamination, the risk of environmental contamination, because you don't have to open the tube and take the things out. That's what we are working on, and we really like to collaborate with Chile, the university, Yale University, and the breeding researcher, and to see if our system can do some kind of real world study test. Because in China we don't have the requirement or need to do this kind of test at home, and we have a lot of testing facilities, and almost no patient and stay at home waiting for this kind of case. So we really want to show prove our system, including the box system, the Baynet box, all this kind of very low cost and enclosed fluorescent system chemistry can work, and to help people and to go through this pandemic. So looking forward to collaboration with Chile friends for the real world study. Thank you.
Thank you, Dr. Bai. Very impressive. And we thank you for sharing this with us today. Now I would like to ask our Chinese colleagues, Dr. Feng and others, if they want to make a brief comment or answer some of the questions that our Chilean colleagues have raised. So, Dr. Feng?
I don't have any additional comments. I think it's a wonderful evening or wonderful morning. So, and at the end, I also quite impressed by the technology introduced by Dr. Bai. So it's very handy and very highly sensitive technology. It's my colleague, but I don't know his technique. So probably I would like to visit his lab and know more. Thank you.
Perfect. Thank you very much. And of course, we want to be in touch with you, and we hope to move forward in this collaboration for the good of our communities, both in China and Chile. So thank you very much for participating in this webinar. And now I want to invite Professor Cheng to give us a brief message at the end of this webinar.
Thank you.
Professor
Thank you very much. Yeah, I'm here. Yeah, thank you, Claudia. I think this is, again, an excellent seminar, and every speakers and panelists are very great, and they pass their information, ideas, and strategy very clear. Actually, thanks everyone here. Actually, I have to say that my Chilean friends, when you explain the situation in Chile, that's really made me worry. I do hope our expert team from Changgung and from, like Dr. Feng from Tsinghua, and we could be helpful in some ways. So I'm not an expert here. I wouldn't want to take a long time, but emphasize that we are here with you, Claudia, and your team. Anything that you need, if you feel we are helpful, we're going to go on with the technical and internal discussion among the experts. So just let her know. Thank you very much.
Thank you, Tao, and thank you very much to all our Chinese colleagues and friends for joining us today. And also I want to thank in particular our colleagues and students from University of Chile. And we do hope to collaborate not just in our university, but with other universities as well. So I want to thank you, and of course we want to keep in touch and to continue this excellent collaboration in order to find solutions that are real and that are important and culturally relevant for our people, and of course even for other countries. So I just want to close this webinar and say thank you to all our participants, and also to all the audience which has been following the seminar, and have a great day in Chile, and a good night to our colleagues in China. Thank you very much.
Thank you. Thank you all. Bye-bye.
Thank you all. Bye-bye. Take care.
Yeah,
Thank you.